Okay, we're going to talk about penicillins, and penicillins are cell wall agents. So basically they inhibit the cell wall formation of bacteria. And so this is what the chemical structure of penicillin looks like. The only reason why I put this up here is because penicillin does have a beta-lactam ring, okay? And this is what the beta-lactam ring looks like. It's here. Okay, and it's important that we know about the beta-lactam ring because this helps to deal with resistance as well as what type of antibiotic that we choose, what type of penicillin. So, penicillins were discovered in 1928 by Sir Alexander Fleming, and they became commercially available in 1941. They actually were a great drug that helped to save millions of people's lives at the end of World War II. Okay. Since 1941 and the advent of using antibiotics, we've been able to increase our lifespan as well as keep people from dying from simple infections. So MOA is the mechanism of action. Penicillins tend to be bactericidal. Okay? They are metabolized in the liver and they are excreted. Usually they're excreted in the active form in the bladder. So they are excreted through the kidneys, and that's what makes penicillins really good for bacterial or urinary tract infections. Okay? There are 4 different types of penicillin. There's natural, broad spectrum, beta-lactamase resistant, and potentiated, and we're going to talk more about those. Penicillins can be used for pretty much anything, bone infections, skin infections, genital, ureteral infections. I've seen them used for upper respiratory infections in cats. So they're a pretty used all drug, but this causes problems when we continue to use them. It can cause bacterial resistance, and it can cause something called it can cause bacteria to mutate and be beta-lactamase. They're beta-lactamase, so they release beta-lactamase, which then kills off the penicillins. So let's talk about the first type, which is Pen-G. And this is a natural type of penicillin. Its spectrum of action is it's narrow, okay, and it can treat Staphylococcus, Streptococcus, and Gram-positive. Okay, it has its DOA, or its duration of action. There's 2 types of Pen-G. There's procaine and there's bethazine. And procaine lasts about 24 hours, and bethazine lasts about 5 days. I had to put this up here because Pen-G tends to be a drug that is used a lot in large animal. So it's important that we make sure that the farmers who are using these in large animal are aware of withdrawal times. There is a product that mixes procaine and bethazine together. This product has a 30-day withdrawal time, so they need to make sure that they follow this 30 days. Pen-G is beta-lactamase sensitive, which means that if the bacteria produces beta-lactamase, it will inactivate the Pen-G. Okay. I wanted to also make sure that you understand sometimes this comes in a white suspension. That's usually what they sell at like Fleet Farm. Never, ever, ever give a white solution. There is one drug that's an anesthetic drug that you will, but other than that, you never, ever, ever give a white substance, something that you can't see through, IV. So please remember that. Put that in your, lock it away in your brain. So SE side effects, GI upset, hypersensitivity. Okay. CE is client information. They need to make sure they keep this refrigerated, and they need to be aware of these withdrawal times. So I also put on here Penicillin V. This is a natural penicillin also. It's very similar to Pen-G. The only difference is that you can administer Penicillin V orally. Pen-G, if they take it orally, is destroyed by the gastric acid in the stomach, but Pen-G actually lasts in the stomach. Everything else is the same, except that CE, if they use a suspension, they need to keep that suspension refrigerated and then discard it after 14 days. And because of the way penicillin V works, you need to make sure it's given on an empty stomach. So a broad spectrum penicillin is ampicillin, and this is generally used in clinics as an injectable. Okay, it's broad spectrum. It does have some GI effects. You do need to make sure that you never give ampicillin, penicillin, or ampicillin, amoxicillin, or even clavamox, which is this amoxicillin clavinic acid, to rabbits, because of it kills off the beneficial bacteria in their stomach, and it can actually cause like severe gastric enteritis, and it can kill a rabbit. So please be cautious when you're using penicillins in rabbits. You want to give it on an empty stomach. It can come in an oral suspension. You need to make sure that it's refrigerated. It is beta-lactamase sensitive. There is one thing I wanted to mention to you about penicillins. They all have this same ending, cillin, S-I-L-L-I-N. So if you see an antibiotic, or if you see a drug that has C-I-L-L-I-N at the end, that means that it is most likely in the penicillin class. Okay. Then there's dicoxicillin. This is a beta-lactamase resistant drug. It's quite expensive. You're not going to really see it used a lot in practice for a couple of reasons. One, it's narrow spectrum, so it only hits gram positive. Okay. It has some GI effects, but you really have to make sure that you give this drug carefully. It has to be given at the exact prescribed time, and the dose has to be given as exact, because because of its narrow spectrum and the way that it filtrates in the blood. So then this drug down here, amoxicillin clavulanic acid, this is also called clavamox. Okay, it is a potentiated penicillin, and basically what potentiated penicillins mean is that they use the clavulanic acid to help the penicillin stay strong against the penicillinase, okay, that the bacteria releases. So it is broad spectrum. Clavamox is probably one of the most popular drugs that they use in veterinary clinics out there. You guys have already seen it a couple of times by now. Side effects, GI side effects, it is oxygen sensitive, so the pills need to stay in the packet. It's also light sensitive, so that's another reason why you keep it in the sealed packet, with each individual sealed in that envelope that it's in. They can give this with food, and you need to make sure that they know to keep the suspension refrigerated, and they need to discard it after 10 days, not 14 days. They need to discard it after 10 days. They need to shake the suspension really well, because in a suspension everything settles on the bottom. So, penicillins. Penicillins usually end with C-I-L-L-I-N. They are beta-lactam. They have a beta-lactam ring. Some of them are sensitive to beta-lactamase. So we need to make sure that we are picking the right penicillin to use, which would mean making sure we're doing culture and sensitivities. Penicillin is also a first-line drug, so generally that means that's the drug that everyone goes to first before moving on to a second-line drug. Thanks.